Hi everyone, I'm Mae McCarmo and you're watching Breathe TV, a beautiful sacred space to come to and exhale and to breathe throughout your breast cancer journey. Whenever I start off the episodes, I always start off with a brief meditation, but I think I might just do some breathing in the moment to help us to ground and to embody what we're going to talk about today. Just close your eyes and you can put your hands on your legs or over your belly or your heart and just breathe. We're going to take about 3 or 4 cleansing breaths. Okay, here we go. Thank you both. I'm so happy to have Valencia have you on and Marquita. Valencia, you know I adore you in all that you do, and so happy to have you, Marquita, as an angel advocate. We're going to discuss today our topics about bone health. And when you think about bone health, you think about people who are older and osteoporosis. And while people get bone health issues when they're older, you can have poor bone health as a young person. And when you have cancer and or it becomes metastatic, it can be really, really hard living with bone pain. Things like fractures, and you don't realize what you take for granted until it's not working really well. And so we really want to be able to help anyone watching of any age, stage, color, gender, to think about the importance of beginning to practice bone health early and make it part of your lifestyle through exercise, yoga, what you're eating, and just different things. We'll start with Valencia Robinson, who is just freaking awesome. I want you to share a bit about your story because you're an educator and you became a breast cancer survivor and warrior, but you're doing so much in the community and you teach yoga as well. So please share with the viewers your amazing and inspiring story.
I was diagnosed, and my children were 3, 4, 5, and 8. And to one of your points about bone health, we don't think about any of that when we're immediately diagnosed, right? You're just trying to get through day to day life, going through chemo, going to appointments, getting scans, and having a double mastectomy, having a bilateral oophorectomy. It was a long 2 years. But one thing that my oncologist introduced me to was yoga and supplements. And she did tell me what my body could possibly go through as a result of my becoming menopausal, right, at the age of 34. My journey began with a lot of information. I was constantly reading, learning, and just trying to keep myself in a positive mindset, which is very important. Mm-hmm. But also, you have to learn the things that you need to change in order to live a better life after the chemo. You know, the chemo, the steroids, the hormonal therapy, all of these things can cause thinning of the bones and joint pain. Even immunotherapy, I've lived it, so I do have a wealth of knowledge to just really share with people about what it's like after the chemo, after the surgeries, and things that they need to do, like yoga, just strength training, walking, light jogging, things that they can do to help themselves. So that's been my journey, helping others, because I did not really have anyone but my oncologist, because Tiger Lily was not around. The advocacy work and the people that I've met, they were not around when I was going through my journey. So I know I have to help, and I have to share and help others as they go through their diagnosis.
Whenever you text me, you always ask about how can we collaborate to help other people, and that's so admirable. I love that about you. Marquita, tell the viewers all about you and your story.
My name is Marquita Goodluck. I was diagnosed at 35. I'm 5 years out now. This year is my 5-year anniversary. So I went through the whole process, chemotherapy. I had a double mastectomy with reconstruction as well as radiation. I was diagnosed with this big disease, and I didn't know what to do, but I know I needed to, find a way to tell my children or to explain my diagnosis and to kind of give them inspiration or hope. So just one night, I just poured my heart out into a children's book. And so I wrote my children's book. It's helped many children and my own deal with the effects of a diagnosis from beginning to the end, and what to expect, and to just give them hope. And so I pretty much spend, a lot of my time motivating other patients, survivors, helping other people, because I know when I was going through chemo, I made a promise to myself that once I got through, I would push it forward, because so many women that I didn't even know poured into me. And so that's my goal now, is to pay it forward and to pour into others and to get them the confidence and inspiration they need to get through it.
That's beautiful. When you first get diagnosed, they don't always ask you what you need or what you want, but there are all these side effects that you hear. And you hear chemo brain, which we all have, bone health, cardiotoxicity, like your heart may have issues, neuropathy, issues with just your own body just does stuff. I was talked to about bone pain during chemo, but I was never talked to about my bone health after chemo. I had a lot of problems with walking during treatment. My bones were just hurting all the time. And then of course they got better. I began to exercise, do training, and just try yoga, things like that. But then I met some friends through the breast cancer space who were metastatic breast cancer patients, and they struggle with a lot of bone pain and fractures. And it was just startling to me that no one mentioned that the very fabric of your body, you cannot exist without your bones, that no one talks to us about those kind of things. And so we began this bone health program to really help people understand the importance of knowing about your bone health when you're young, because at some point, if you're lucky and blessed, you will get older. And if you get sick, your bones are an important part of your healing process, right? Marquita, were you ever talked to about bone health while you're in treatment?
So I think I had the same experience you had. I used to have horrible heel pain during chemo, but after, I didn't really expect the bone pain that I have now. It just seems different. It seems like it's more intense. I don't think I expected it to be, this much bone pain. And I also didn't expect to always be confused as if wondering if it's arthritis, if it's bone pain, or if it's metastatic or whatever. It's really hard, the constant, trying to figure out what it is.
They treat you when you have cancer, and then they're like, you're done. But then who's treating you the rest of your life as you're having to deal with survivorship and these side effects? My bone pain got worse and worse, and I couldn't even turn around over in bed. I would have to hold myself sometimes and to turn my body in the bed. And when I got up in the morning, I would have to get up and just go stretch slowly. And I'm like, what is going on? It began probably the year before that and got worse and worse, but it was all of a sudden. And it wasn't for lack of not being healthy, but when I began to read and talk to my doctor, they said, well, these things can happen over time and it can be delayed. I kept thinking, do I have cancer again? Is it metastatic? So I spent all this time seeing doctors, getting all these tests done, and they're like, no, it may just be a side effect from your treatment that is now flaring up again. And that's where, for me, doing more yoga and more weight training came in. And Valencia, your yoga teacher, how can yoga build your bones and your flexibility, and how the two improve your bone health but lower pain during and after cancer treatment?
Well, I think one thing that we all need to realize is that bones are dynamic and alive. Your bones and your muscles work together to support every movement on a daily basis, right? So they're alive. So everything that we do, we have to strengthen our muscles. And that's why strength training is so important, because strong bones and muscles protect against injury and improve balance and coordination. So that's where the yoga comes in. You can do your strength training, and here I am, got my weight here. And I have my kettlebell here. Oh! Yes, yes, yes. Because this is the thing. I was doing yoga, and yoga is amazing. And I was only focusing on yoga after my treatment, because that's really all I could do. I couldn't lift a kettlebell after I had 5 surgeries on my chest. I couldn't do the strength training, right? So my oncologist, well, she told me that I probably wouldn't last, I wouldn't make it 5 years because of triple negative breast cancer.
Mm-hmm.
That is just the reality, that a lot of ladies, a lot of people do not survive triple negative disease. Mayma, you know this. So she was brutally honest, but she really empowered me. She was so willing to help me learn and do what I could to better fight the disease, right? You know, it has to do with the impact of your feet on the ground and how that impact radiates up through your body when you jump or when you jog. You know, it puts pressure on the bones, which sends a message to your body, okay, she's putting pressure on me, so I gotta get stronger, I gotta get stronger. It may be difficult. I'm not saying this isn't easy. It's not easy. You know, even just the idea, and mainly you were just saying that getting up in the morning, sometimes you feel the little achiness and it's hard, but if you can just push and slowly get yourself up, maybe go for a walk, all of these activities will really, really help your bone health and help your mental health. I mean, it's just what we need to do daily, regardless if we're a survivor or not, but especially those of us who have gone through and survived this diagnosis, who are going through the diagnosis on a daily basis. These are the things that you need to do every day. You gotta love your bones. You gotta love your body. You gotta take care of your body. And in turn, it will support you and it will live and flourish.
Amen. Hallelujah. Praise the Lord. And Marquita, for you, you're thrust into this breast cancer world and you're now an advocate and you're, sharing what you've learned. We don't often talk about our bone health. How have you learned about bone health, and how are you sharing with others the importance of being bone health aware and loving their bones?
So one of the things that I do is I stress the importance of vitamin D, because I remember way before I ever had breast cancer, the doctor used to always tell me my vitamin D was low. I would forget to take the supplements they would give me, but I realize now they never explained the link between, vitamin D and breast cancer. So I just can't help but to look back and think like, wow, maybe I should have took the supplements. I meet a lot of women who were given the same advice. They too have the same kind of response. So I do kind of push to be preventive, to take care of your bones. Like the vitamin D is important. And also like you said, the strength training. And one of the things I learned is like when I would get hurt, I often would try to like not move. And it was like the worst thing ever. So I learned like actually moving even when you are hurt is something that I try to encourage people to do it anyway. Because I've learned the more I stayed still in pain, the worse it has become for me.
Mayma, I got my vitamins here. I got my vitamin K2 plus D3.
Yes. Valencia, you're a whole show.
Yes.
Citrate, which has D3, and it says supports bone health, supports heart health. The K2 and the D3 supports heart health and bone health. And then I have my magnesium. Yes, I was prepared because
you
people
came prepared, girl.
they need visuals. Marquita, great job. I had it here ready because we think we eat right all the time. We're not eating enough food that's going to give us the amount of vitamin D that we need. We're just not, or the calcium or the magnesium. We're not eating enough things that will help repair the trauma that has taken place in our body.
But a lot of foods, even foods that are good, when you cook the food, they're stripped of vitamins and nutrients. People think they're eating healthy, they're eating all this green stuff, they're having calcium, but then when you cook the food, or even getting from the farm, the ground to the shelf, is shipped and is stuffed with toxins. So you're getting a watered down version of what you should have. So supplements are really, really important as well. I have a whole closet in my kitchen. It's like my little alchemy closet. It has like all these vitamins, supplements. I crave knowledge about my body, how to be healthy. So I have supplements, vitamin D, magnesium, melatonin for nighttime for sleep. Because sleep is your body repairs when you're sleeping too. So bone health isn't only just it's fitness and all that, but you have to also be able to rest to repair your bones so that it can work for you. So, I have my little closet as well, which is really helpful. And then I do juices, green juices that have things that help to repair your bones as well. It's just really important. So like yoga, stretching is important, what you eat's important. And I'm super excited. I've been exploring raw veganism. I learned the importance of eating raw foods. And raw food isn't just like sushi. It's like green foods that God made that are coming from the earth that have not been altered by anything except the ground, the dirt, and the sunlight, vitamin D. And to be honest, my body's changed so much in the past 2.5 months, so much. The foods are not full of chemicals. It's pure organic raw food, not on the shelf even. I buy them raw. I buy shelf food sometimes, but I'm really careful as much as I can be. And not only have I lost weight, but it wasn't about losing weight. It was about getting clean of inflammation and things that were not having a body that wasn't alkaline, which can also impact your bones. It's a privilege to be alive and a privilege to be able to have access to supplements and yoga teachers, but many people don't have access to these things. Give patients, when they're diagnosed, like information on what to know now and how to afford it now and have access to it versus waiting until they have fractures later or bone pain when they're metastatic or just because of time. What are your ideas, you guys?
For me, I like to do acupuncture, and I believe that it works. And so, because people are always like, does it work? I feel better afterwards. But it was surprising to me that my insurance actually covered it, but I was never told by a doctor to try acupuncture. And so that's something that I was able to incorporate. And I find a lot of women don't realize that some insurances cover something like acupuncture. And it has helped me with even after having a mastectomy and being able to lift my arm up. I guess it's resources and knowing that there are some things that we can do. And there's some things, of course, that we can't. So, we don't all have the same insurance. So I understand that.
I wish there was a way that they would fund complementary care, things like yoga, Reiki, acupuncture, fitness, right? Even supplements, as are applicable, so that not only you get the brochure that says eat healthy, exercise, and take your vitamins, but here's how to afford it if you don't have the money. Here's a way that you can get access to it. Because when people have treatment, it really can hurt your bones. And I have patients of mine and friends of mine who have metastatic bone disease. It's so painful. I had somebody call me the other day who had bone fractures and she couldn't move. So imagine it's not just your back hurts. You can't cough, you can't sneeze, you can't lift your arms. Because she is metastatic and she's 5 years metastatic now, every part of her body hurt and her bones were fracturing from the medication that was supposed to help her. And so it's a really complex situation that you have to take the drugs to get you to kill the cancer, but the cancer is still doing what it does, right? How would you help somebody, this may be a tough question, that's living with metastatic bone disease and needs support during that process when they can't even really move a lot? What would you offer them as advice or support? Valencia?
After I was diagnosed, my sister was diagnosed. Now I have an aunt, my mother's sister, who is metastatic, and she has the disease in her spine, leptomeningeal disease in her brain. I came to DC. One way to support is actually being there, physically being there in their home to help prepare the meals, to just be there to do whatever they need done. So I was with my auntie. We didn't think she was gonna make it. From October to December, we did not think she was gonna make it. And I'm gonna tell this story because it's so powerful. When I arrived to my aunt's house, she was taking so much medication between her chemo, between her high blood pressure, between pain meds. She was taking so much. So her sister was with her and she had the pill box. So she's telling me what she's taking. And I'm just like, what is all of this? And I'm like, are you in any pain? Sometimes patients can be overly medicated. Mm-hmm. I told my auntie, I said, you gonna stop taking this? She never had high blood pressure before, you know, and I know her blood pressure was elevated because of the treatment, because of the disease, but I called her doctor. I talked to the pharmacist. I got her on a schedule and half of her medication. Now all she takes is are her chemo pills. That's it.
Wow.
And even with that, her chemo medication, they had to stop her from taking it because her blood work was not good. So they're like, okay, they had to bring it from 150 milligrams to 100 milligrams to 50 milligrams. She is in a much better place. She couldn't drive. And I told her, I said, before I leave, you need to be able to drive because you cannot have us enable you. I got her on the road to recovery within a week and a half, just by altering her medication. No one else in the family knew what I knew because of what I'd gone through, because of what my sister had gone through. So it was easy for me to get on the phone and call and talk to her medical team, and they made the adjustments. That's what people need. It's like they need a personal advocate. They need people who know what they're talking about to help. She is in a much better place now, so much better, because I was able to assist her. And I know people don't have, but they need to ask for help. They need to ask the nurse navigators. They need to tell them what symptoms they are feeling, you know, when they take the medication. Because I'm like, how does this make you feel? She was like, I don't know, but I don't feel good. I don't feel good. And she was taking too many pills. So I just wish that we could just have many of us really paid to do this work. That would be ideal.
So what you're suggesting is that it'd be great to have a patient advocate in the hospital. I think that's an excellent idea. I mean, that's what I want to see. One of the misconceptions is that once treatment's over, that you're going to just bounce right back. People think all the time, the world thinks that, you know, you're going to have chemo, surgery, radiation, and then you just kind of go through a period of healing, then you're fine. And you're not. You have a lot to deal with in terms of surviving breast cancer, the body pains you may experience, chemo brain, bone pain, and things like that. What do you think patients need in terms of, as it pertains to bone health? What would you put in place, Marquita, to be able to give patients that supportive care?
To me, the biggest misconception is that everything's fine and you're okay. I find even myself, when I undergo things or I go through bone pain, I don't always want to tell people in the outside world because they think, you know, that it's just like, it's a done deal, you're fine. And I'm like, I'm only 40, but I have bone pain. So I think educating our caregivers, or if there's a way to educate people outside of the breast cancer community to get them to understand the whole point that this surviving is a struggle. It's hard, it's continuous, it's something that every day we have different ailments that we have to deal with.
I agree. And I think as women, we try to be strong for our families. So even though I do all I do, I exercise, I run, I eat healthy and all those things, but I'm doing that to as much prevent and risk reduce as it is to repair my body. I think we don't often talk about this enough. Like I never really shared before in public that I have bone pain. Nobody would know. People just say, you know, you're fine. You're always running around, you're posting on social media, you're doing your advocacy work. I just feel like I really want there to be as much empowerment around the things that are painful and that hurt as there are around things that are great, like we're still here and we're breathing and we're discovering our purpose. So we have to be also honest about things that aren't too pleasant, right? I mean, it's being vulnerable.
I agree. I don't often, I'm the same way. I can speak to a breast cancer survivor that I met today, more about this, more than I can other people, because it's just, I don't think they understand that it's a continuous thing. And then also at the same time, I don't want them to have the impression of maybe they will think I had meds because they're like, oh, you have bone pain. And immediately family members, I noticed they're like, they're on alert. It's like, they don't understand. It's just, it's a part of the survival. It's not that the cancer has, come back or anything like that. So it's a whole explanation. So that's something that I too encounter.
My daughter knows everything, but nobody else knew I was having all this pain. In the morning, I had to literally go through a process to get out of bed. I couldn't sit down for a long time or even get up and walk around for a long time. I didn't know why I didn't tell anybody about it. And I'm the biggest big mouth. I discuss everything, but I was like, how am I having this problem? Am I sick? What did I do wrong? And so we're all going through that process of learning how to be vulnerable. But for me, I really want to empower women who are younger, just beginning their breast cancer journey, and women who are going through, having metastatic and experiencing that. It's important to just share how you feel. And it's important to me to share because I look at my younger self and I'm like, I want you to know that it's okay to start to empower yourself. It's okay to work out. Not just to be skinny, but to have your living organism that's your bone be healthy. You never know when you're going to have a health challenge. But if you're doing the right things like supplementation, eating the best foods, you can eat healthy green, the rainbow type of foods, exercising, doing yoga, weight-bearing exercises, and a variety of other things, as well as resting and hydrating. Your bones need a lot of water as well. Don't be afraid to speak your truth as well. If you are not feeling well, you have to ask for help. Marquita, what is your one word for the year, or a phrase that for those who are watching who could be empowered when it comes to their bone health? What word could they manifest?
Okay, so I like the word now, I guess because of Ketanji, it's persevere. It's my word now.
Persevere. Valencia?
You have to keep pushing through, keep working out, even when you don't feel like getting up. Keep eating the best nutritious foods that you can afford, because it will totally impact your overall health and your bones. And that's what people don't understand. They don't understand that what they eat, how they live, how much sleep they get, everything that we just all talked about really affects even their bones. People just don't understand that. They don't understand that their bones are alive and dynamic, and that they need support and they need the healthy things. So I don't know, my one word would be health. And I gotta say this. This would be my one word. Your breath, okay? Breathing. And this is one thing that people don't realize that is so powerful. Starting around the age of 30, bones in our chest become thinner and collapse inward. We lose about 12% of our breathing, of our lung capacity, making it difficult to breathe by the time we hit 50. And then the speed up declines, right? We're forced to breathe faster and harder, making it more difficult to just catch a breath. Even the bones in our chest, they collapse inward, starting around the age of 30. So the breathing exercise that we started with, Mayma, that will help expand our lung capacity, that will rejuvenate our cells, give us energy. Breathing, that's my one word. Breathing changes everything. The quality of your breath is the quality of your life.
Everyone, there you have it, from Valencia's mouth to mine to yours. The quality of your breath affects the quality of your life. So until next time, take deep breaths. Love your body, love your bones, love yourself, and much love to all of you. And for now, I'm going to sign off and just say bye for now. See you next time.